All right, so now we're going to do chapter 40, or attempt to do it. Like I said, it's storming here, so hopefully we can get through this. All right, so we're talking about sensory perception of hearing, also known as audition. This is the process by which the auditory system detects and interprets sound waves, allowing us to perceive and understand the world around us through sound. The auditory system converts sound waves into electrical signals that are processed by the brain, which enables us to distinguish the different sounds, their sources, and their meanings. Okay. All right, so it talks about the two types of hearing loss, conductive and central neural. Those are the two types of hearing loss. Conductive means something's obstructing the airflow from the outside to the inner ear, whereas central neural means there's damage in the inner ear with the transmission of sound. So there are some of the risk factors for both conductive and central neural. And then it talks about the assessment. A hearing acuity screen is a basic test designed to quickly assess how well someone hears different sounds. It's a preliminary check, not a comprehensive diagnostic test. The goal is to identify individuals who might have hearing loss and those that need further evaluation. All right, so when you're checking those ears, you want to know when you're doing your assessment, you need to wash your hands and clean any visible debris from the outer ear. Have the patient lie on their side or tilt their head to the affected ear, with the affected ear facing up. You're going to straighten the ear canal. In adults, pull the pinna, which is the outer ear, up and back to straighten the ear canal. Whereas children under 3, you're going to pull the pinna down and back. So if you're putting in any drops, you're going to hold the dropper near the ear opening without touching the canal and squeeze the bottle to allow the drops to flow down the side of the ear canal. Then you're going to massage, release the pinna, and gently massage the tragus. The tragus is the small fleshy part in front of the ear canal to help the drops move deeper into the ear. You need to have the patient remain in the lying position with the affected ear up for 5 to 10 minutes to allow the medication to absorb. And then you're going to repeat the procedure on the other ear and perform your hand hygiene. All right, so as a part of the assessment, you're going to assess function, frequency of asking to repeat things. If they're withdrawing from social activities, they're shouting in conversations, or they're answering questions incorrectly. This indicates that they possibly have a hearing problem. You're going to do ear assessments, typically involve both inspection and palpation of the external ear, as well as using the otoscope to visualize the ear canal and the eardrum. The external ear assessment, you're going to use inspection of the external ear, which is the auricle. You're going to check the size, the shape, the symmetry, and color. You're looking for any abnormalities, lesions, or signs of inflammation. And then you're going to palpate it. Gently palpate the auricle and the tragus and the mastoid process, because you're checking for tenderness, swelling, or any masses. Then you're going to go look in the ear canal or at the eardrum with the otoscope. It's used to visualize the ear canal and eardrum. You use a speculum, which is inserted into the ear canal while looking into the otoscope. The otoscope is used to assess the ear canal for signs of obstruction, inflammation, discharge, or foreign bodies. Also, the color and condition of the ear canal. Look at the eardrum, which is also known as the tympanic membrane. It should appear flat, gray, and translucent. Normal landmarks like the cone of light. The cone of light in the right ear is at 5 o'clock, and the cone of light in the left ear is at 7 o'clock. Also, the handle of the malleus, the bony oscles, should be visible. Special tests we can do are hearing tests, including the whisper test, the tuning fork test, and we can do audiometry. Balance test we can do is the Romberg test. So you can do the Rhine and the Weber, and you can do the Romberg for the balance. Normal findings: skin color colored in the ear canal, small hairs may be present. They may have some yellowish brown earwax, some light gray or pearly white looking eardrum with light reflecting off the eardrum. Okay, now abnormal findings: red or a bulging eardrum, red tender, swollen or pus-filled ear canal, amber liquid or bubbles behind the eardrum. Those are all abnormal and they should be reported. Now, audiometry, this determines hearing ability by presenting tones and speech at different volumes and pitches through earphones in the soundproof room. Responses to the sounds are recorded to create an audiogram, which visualizes the degree and type of hearing loss. So you've got pure tone audiometry. This tests hearing thresholds for different frequencies. Speech audiometry, it measures the ability to understand speech in noisy environments. Then you got the bone conduction test. A vibrating device is placed on the bone behind the ear, transmits sound directly to the inner ear, bypassing the outer and middle ear. This can help differentiate between conductive and central neural hearing loss. You also have the autoacoustic emissions test, which assesses the function of the outer hair cells and the cochlea by measuring the sounds they produce in response to stimuli. You also have the auditory brainstem response. This test evaluates the auditory nerve and brainstem pathway by measuring electrical nerve impulses generated in response to sound. Then you got the middle ear test, tympanometry. This measures the movement of the eardrum in the middle ear in response to pressure changes, so it can identify fluid, eardrum perforations, or dysfunction with the eustachian tubes. And then you got the pneumatic otoscopy, a manual technique for assessing tympanic membrane mobility by applying gentle positive and negative pressure. Immobility of the eardrum can indicate middle ear effusion or collection of fluid. Then you got the acoustic reflex, which measures the middle ear's muscle response to sounds. And then you've got balance tests. You've got the vestibular diagnostic testing, so the caloric testing. You can use warm or cool air or water into the ear canal to stimulate the horizontal semicircular canals. This will induce a reflex eye movement called nystagmus. This helps assess the function of the vestibular system and identify unilateral or bilateral vestibular weakness. Okay. So there's plenty of tests they can do here. All right. So then it goes into talking about prevention. Just be aware of a lot of those ototoxic meds, like your loop diuretics, your aspirins, and specifically antibiotics like the aminoglycosides. All right, so then it goes into interventions. Non-surgical, they can use antibiotics if there's an infection, hearing aids, amplifiers, or phones with text. Surgical interventions are tympanoplasty. This fixes the middle ear. They can get cochlear implants. Remember, if you're communicating with someone that has a hearing issue, you want to speak clearly and slowly, avoid shouting, and use clear, distinct speech without exaggerating. Get the patient's attention. Ensure the patient is facing you and they're aware you are speaking. Rephrase, don't repeat. If the patient doesn't understand, rephrase the information rather than simply repeating it. Facilitate lip reading. Speak directly in good lighting and avoid obstructions that might block lip movement. Use gestures when appropriate. Use visual cues to aid understanding. Make sure you talk in a low, deep voice. This can sometimes be easier for people with hearing loss to hear. Minimize background noise. You want a quiet environment. As far as hearing device support, ensure the hearing aids are working. Check for proper placement, functionality, and battery level. Encourage consistent use. Hearing aids should be used regularly to maintain neural pathways and prevent further hearing loss. So review and maintain devices and ensure hearing aids are properly cleaned and maintained. Now, for any cerumen, this is earwax. This can exacerbate hearing loss, so regularly remove the cerumen. Explain hearing loss and its impact. Educate the patient and family about the causes, the effects, and the management options. Advocate for further evaluation and encourage them to seek an audiological assessment and intervention. There's also support groups and resources, so you can connect them to the relevant support group or resource. Ensure there's good lighting all the time. Good lighting facilitates lip reading and visual cues. Provide a comfortable environment. Minimize distractions. You need a quiet space for communication. Address emotional and social impact. Hearing loss can have an emotional consequence, and nurses can provide support. Encourage self-advocacy. Help the patient advocate for the needs and communicate their preferences. Now, we got to know how to care for a hearing aid. Okay, very important test questions here. We wipe the ear mold and hearing aid with a soft cloth or tissue to remove earwax, debris, and moisture. Inspect the opening of the ear mold for wax buildup and gently remove it with a wax pick or a brush. Avoid using sharp objects that could damage the hearing aid. For behind the ear hearing aids, clean the tubing with a wire loop or cleaning tool. As far as battery management, check the battery regularly and make sure you replace it when it gets low. Store the batteries in a cool, dry place from children and pets, and turn off the hearing aid and open the battery compartment when not in use. When you store a hearing aid, it's designed to be in a case or a charger, especially if it's rechargeable. For non-rechargeables, store them in a dry, cool place and consider using a dehumidifier overnight. Avoid getting the hearing aid wet. Remove them before showering, swimming, or washing your face. Do not use hairspray or other hair care products while wearing a hearing aid. Educate the resident on proper hearing aid and care and maintenance. Encourage regular cleaning and proper storage to prevent damage. Remind residents to avoid using water, solvents, or oils to clean the hearing aid. And advise the resident to keep replacement batteries and a small hearing aid away from children and pets. Handle hearing aids with clean hands and avoid dropping them. Ensure the hearing aid is properly inserted into the ear and that the tubing is securely attached. Be mindful of the microphone and receiver port and avoid inserting anything into them. If the hearing aid is not working, consult the audiologist and hearing specialist for any further assistance. Okay, so it's just ask a question and then it goes into otitis media. Children who are not yet verbal may consistently tug on the affected ear, and this is a sign of a middle ear infection, because that's what otitis media is. It's a group of inflammatory diseases of the middle ear, often referred to as a middle ear infection. It's going to have some inflammation, fluid buildup behind the eardrum, and it's common especially in children. While most cases resolve on their own, some require treatment with antibiotics. The types, you've got acute otitis media, which has a sudden onset, often with pain and fever. You got the otitis media with an effusion. That's when fluid remains in the middle ear after the infection has resolved. And you got the chronic suppurative otitis media, which is a persistent infection that causes a perforated eardrum. So ruptured tympanic membrane. Okay. Then you get into the otitis externa. This is also called swimmer's ear. This is an inflammation or infection of the external ear canal. It's a common condition, particularly during the summer and tropical climates. It's caused by a bacterium, fungus, or an irritant. The symptoms include ear pain, itching, discharge, and sometimes hearing loss. The treatment typically involves topical antibiotics or an antifungal ear drop and pain relief. You have to teach the patient to avoid getting the ear wet or water in the ears. Okay. Then it talks about mastoiditis. Okay, mastoiditis. A bacterial infection of the mastoid bone. This is serious. This bone is located behind the ear. It usually stems from a middle ear infection that was untreated, so some type of otitis media. It's characterized by symptoms of ear pain, drainage, swelling behind the ear, and fever. Prompt treatment, typically with antibiotics and sometimes surgery, is crucial to prevent serious complications that include hearing loss or even meningitis. So this can make its way through those meninges, this infection. All right, then we talk about ear trauma. Okay, so you got different types of ear trauma. Outer ear trauma, this can involve injuries to the auricle, such as a hematoma, which is a blood clot, a laceration, or that cauliflower ear, a deformity caused by repeated blows. So you'll see that repeated blows. You'll see that with them MMA fighters and boxers. They have that cauliflower ear. You ever see cauliflower ear? Don't mess with that person. Then you got middle and inner ear trauma. This can include damage to the eardrum, which are the ossicles, the bones, or inner ear structures. And these are caused by blows or sudden pressure, some type of barrel trauma or head trauma. Then you've got acoustic trauma. This refers to hearing loss caused by exposure to loud noises, like an explosion or a prolonged exposure to machinery. Then you got the barrel trauma. This is damage to the ear caused by sudden change in air or water pressure, often experienced during flying or scuba diving. So what are the symptoms of ear trauma? Ear pain or ache that can range from mild to severe. Any bleeding from the ear. This can indicate a ruptured eardrum or other injury. Hearing loss can be temporary or permanent, depending on the severity. Ringing or buzzing in the ear called tinnitus. That can be a symptom of various ear injuries. Dizziness or balance problems can indicate damage to the inner ear or the vestibular system. Any discharge from the ear can be a sign of infection or other injury. Or any feeling of fullness or pressure in the ear can also be a symptom of barrel trauma or a middle ear effusion, which again was that collection of fluid. All right, next it talks about tinnitus. This is the perception of sound when no external source is present. It's often described as ringing in the ears, but it can also be like a buzzing or a hissing or even a clicking or a roaring sound. It can be temporary, like after a loud concert, or it can be chronic, affecting every day. The treatment is to identify and treat the cause. If possible, address the underlying cause of tinnitus, which can help reduce or eliminate the symptoms. We can use hearing aids for those with hearing loss. They can amplify external sounds, making the tinnitus less noticeable. They can also use tinnitus maskers. These devices produce background noise to help mask the sound. Tinnitus retraining therapy. This therapy helps individuals habitate to the tinnitus, making it less bothersome. Stress management. Stress can worsen the tinnitus, so teach them deep breathing, yoga. Counseling can help cope with the emotional impact, or medications. Some medications are used to manage tinnitus-related symptoms like anxiety or depression. All right, then we get into Meniere's disease. This is an inner ear disorder. It causes vertigo, which is a spinning sensation, and tinnitus, which is ringing in the ears. It can lead to hearing loss, a gradual hearing loss, unilateral, usually on one side, and a feeling of fullness in the ear. The exact cause of Meniere's is unknown, but it's believed to be related to an imbalance of fluid in the inner ear, the endolymph fluid. So some contributing factors could be an abnormal immune response. The body's immune system might be attacking the inner ear. A viral infection, head trauma, genetics. Maybe they have some type of hereditary component. Now, the treatment: diuretics, antiemetics, and antihistamines. They can help manage symptoms during attacks. A low sodium diet, reduce caffeine and alcohol, and if you're a smoker, stop. Also, hearing aids can be helpful to manage any hearing loss, and in rare cases, surgery may be an option if other treatments are ineffective. For the vertigo, we need to teach them, prevent stimulation, restrict movement of the head, and change position slowly. Avoid caffeine and alcohol. Rest in a quiet, darkened environment when the vertigo is severe. Use assistive devices as needed for ambulation and balance. Maintain a safe environment free of clutter. Take a diuretic to decrease the amount of fluid in the semicircular canals. And when you do drink your fluids, space them out throughout the day. Decrease the intake of salt and sodium containing foods, those processed meats that contain that MSG. Okay. All right, then it talks about an acoustic neuroma. That is a tumor that affects the vestibular-cochlear nerve, so it's going to interfere with both balance and hearing, and it can interfere with cranial nerves number 5 as well, trigeminal. All right, so here's a case study. Let's see, what do we got? A case study. Is that all we got left? Yeah. All right, so that concludes the presentation. Now, you do have the midterm coming up, so I do want to give you some things that you should be looking over. Just understand genetic conditions. Understand the toll that genetic conditions can have on families. What the concern is about possibly having a baby that's born with some type of condition that they've inherited. And what would be some of the best nursing interventions for that. Also, your COPD patient, either chronic bronchitis or emphysema, what is normal and what is abnormal for them to present with? What are some things that are associated with these conditions? You need to know that. Any trauma to the face or the nose, what issues would you focus in on? All of your transfusion reactions that you learned when you were learning about blood products. You got to know the difference. Which one is which? Anaphylactic versus transfusion-associated circulatory overload versus hemolytic. You got to know the signs and symptoms. What are we going to see with each? What do we expect to see? Make sure you know your latex allergies and the foods that are associated with that. Understand everything, the signs and symptoms that are associated with a transfusion reaction. What you do if there's a transfusion reaction. Understand informed consent. Everything you need to know about informed consent. Bone marrow aspiration. How do we do that? What's the best site for that? Knowing how to run blood. Everything that we went over as far as running blood. Understand negligence. Understand torts. Understand certain medications like propofol and penicillins and cephalosporins. Understand conditions such as asthma. Understand sickle cell, all your anemias. You got to know the difference in your anemias and what you could see with your anemias. Know your foods, know your iron teachings and your foods that are high in iron. Understand all your signs and symptoms around that. Know all your fluids. Know what conditions put the patient most at risk for fluid deficits. Know what solutions you would give if they had too much or too little of a certain electrolyte. Understand your drains, your Penrose drain, your JP drain, your Hemovax. What's the difference in each? Know what the Guaiac test is and how to conduct it. Understand lupus and the complications of lupus and what you would check to determine the current status of your patient with lupus. Understand what to do before surgical procedures. Understand psoriasis and everything you need to know about that. Understand those anthropometric measurements. Understand your medications for replacement of both red blood cells, white blood cells, platelets, and iron. Understand what's involved in wound healing. Know how to identify skin cancer lesions. Know Lyme disease and the different stages of Lyme disease. Understand fluid volume overload. Know how to do a wound irrigation. Know how to insert an IV. Know your math. Know your sterile procedure, how to open a sterile packet, how to pour the liquid. Know what you do before you collect a culture for a wound. Know your different types of drainage: serous, sanguinous, serosanguinous, pustulant. Know the difference between clear liquid and full liquid diets. Know all your torts. Understand pediculosis capitis. Understand what's the best indicator of bowel patency. What do we do to prevent paralytic ileuses? What are the hallmarks of peritonitis? Understand ulcerative colitis. Understand appendicitis and where would the pain be. Understand diverticular disease and where would the pain be. What are the complications of peritonitis or diverticulitis? What are the warning signs of cancer? Know your primary, secondary, tertiary healthcare interventions. And understand COPD.